A 30-year-old male patient presented with sudden painless diminution of vision in the left eye for last 7 days, and the left eye fundus showed a large submacular cyst resembling a white pearl with a high reflective center, suggestive of cysticercosis cyst with a central scolex. The OCT showed a hypoechoic area in the subretinal space with a high reflective center, suggestive of scolex. Fundus fluorescein angiography showed pooling of the dye within the cyst with a hyperfluorescent area adjacent to it, suggestive of the point of entry of the cyst into the subretinal space with some RPE alteration surrounding it. The cysticercosis cyst was seen in the submacular space. The undulating movements of the cyst were well appreciated on throwing the light from the endolight. Intravitreal triamcinolone was then injected to stain the posterior hyaloid face. Posterior vitreous detachment was induced using active suction from the vitrectomy cutter. A 41 gauge cannula was then used to inject the saline in the submacular space. Simultaneously, perfluorocarbon liquid bubble was injected over the optic nerve head. Some more saline was injected through the 41 gauge cannula, and some more perfluorocarbon liquid was injected and the size of the bubble increased. As the cyst moved towards the opening of the 41 gauge cannula, a beautiful foveal reflex could be well appreciated. It appeared like the cyst was moving towards the 41 gauge cannula opening. A soft tip cannula was then used to take out the cyst into the vitreous cavity. The cyst was delivered using a soft tip cannula. The cyst was then eaten away using the vitrectomy cutter. This was followed by fluid air exchange and laser was done. This was then followed by exchange of air with 20% of SF6 tamponade. MRI brain was done, which showed disseminated hypointense nodular lesions suggestive of neurocysticercosis. Patient was started on anti-epileptic and anti-helminthic drugs and the oral steroids were continued. At 6 months follow-up, the patient recovered a vision of 612 N9 in the left eye and the OCT showed normal foveal contour in the left eye. Cysticercosis is a parasitic tissue infection caused by larval cysts of the tapeworm Taenia solium. These larval cysts infect the brain, muscle or other tissues and are a major cause of adult onset seizures.